Philadelphia, the largest city and capital of the United States, is in the grip of an unspeakable terror. Not from violence or an invading army, but from a disease, the dreaded yellow fever. The 1793 epidemic started in August, and by October was killing nearly 100 Philadelphians per day. When it finally ended, the epidemic had claimed over 5,000 lives, 10% of the city's population. Adding to the tragedy of this epidemic were crude medical treatments and lack of any organized response to the crisis by the city of Philadelphia. From the depths of this tragedy, however, emerged a triumph for future generations. The idea of public health, organized response, and prevention to promote the safety and health of cities and communities. In response to the 1793 epidemic, Philadelphia developed the first board of public health in the United States. Now the city's Department of Health, it has evolved over time into an organization dedicated to research, education, communication, and prevention of the many health challenges still facing the city of Philadelphia. Philadelphia's 1793 epidemic began with the bite of the Aedes aegypti, the yellow fever mosquito. Yellow fever attacks its victims in two stages. The first had aches and pains much like the flu, which went away and often did not return. The less fortunate would fall under the second stage. Descriptions of this are horrific. External bleeding from the ears and nose, jaundice, black blood-filled vomit. As the disease consumed the internal organs, death would shortly follow. Philadelphia, at the outer edge of the mosquito's normal range, had not suffered from a yellow fever epidemic since the early 1760s, and a tragedy of the 1793 epidemic was a perfect storm of three different factors. First, the city experienced an abnormally dry, hot, and humid August, making the marshy swamps around the city perfect places for mosquitoes to breed. Second, Philadelphia also suffered from appallingly poor living conditions. Close living quarters, filthy streets, little clean water, uncovered sewers filled with human and animal waste, garbage and standing water, all ideal breeding grounds for mosquitoes and spreading diseases. Last, Philadelphia was also a victim of its position as the largest port city in the United States. Arriving that spring were 2,000 refugees fleeing the slave revolt on the French colony of Saint-Dominique, modern-day Haiti. Both the ship and its passengers likely carried the yellow fever virus and mosquitoes into Philadelphia. Philadelphia physician Benjamin Rush first became alarmed on August 19th when he recognized the symptoms of yellow fever in Peter Aston, who died within hours of Rush's visit. Initially, the disease stayed around the waterfront section of the city called Helltown, but Rush's letter books from the epidemic document the fast, terrifying spread of the killer virus throughout the city. By September, over 60 residents a day were dying as the city descended into chaos. The voices of the increasing number of letters received by Benjamin Rush demonstrated the growing panic of the city's residents. I have spit blood these 3 nights past, but particularly last night from half a pint. She appears to me in great danger. The whites of her eyes, the skin of her face, are a little yellow. Please, send someone. My cousin is in great danger. I remain your just now friend. She vomited and brought up a matter strongly colored with bile. Please, she appears send someone. My cousin is in great whites danger. Of her eyes, I remain. Magnifying this tragedy was the lack of adequate medical treatments and organized public response to the epidemic. The city's doctors, including Rush, were powerless to provide a course of treatments for victims. Most attempted a mix of bleeding, purging, ingesting mercury, and even a glyster, which was an enema of tobacco smoke. Nothing worked.
Benjamin Rush was one of the fathers of American medicine. And Benjamin Rush, who lived right downtown Philadelphia, his theory was that your blood carried the virus, true, but that getting rid of the blood would make you better. So his approach was to withdraw blood from patients. So we think he probably caused as much death as the virus itself caused.
As panic grew, Philadelphia's College of Physicians published 11 recommendations for the city's residents to follow. including avoiding sitting in the sun, fatigue of body and mind, and warm clothing. Other recommendations were more useful, including avoid contact between the healthy and sick, and creating a hospital for the poor and cleaning of the streets, wharves, and of the city. But who was left to carry out this plan? By the end of August, most of Philadelphia's citizens had fled for safer areas. The federal and state governments also had fled, leaving the city's officials on their own. Out of desperation, a group of Philadelphia's most prominent citizens pulled together to manage this epidemic. Known simply as the Committee, the members of the group collected funds and established and staffed a hospital for yellow fever victims at the abandoned Bush Hill estate. None of their measures were truly effective, and the epidemic only ended with the onset of winter. From the depths of this tragedy came the triumph of public health. Many of the citizens who served on the committee formed Philadelphia's first Board of Health in 1794. The board first focused on the large amount of orphans left by the 1793 epidemic, and organized responses to epidemics in 1797, 1798, and 1799. Deaths from yellow fever began to drop significantly when the board moved the lazaretto, a quarantine hospital, downriver from Philadelphia into nearby Tinicum Township in 1799. During the 19th century, the Board of Health slowly grew into a preventative role, starting with the creation of the first municipal water supplies in the United States. The first pump house, located at Broad and Market Streets, was later replaced by the Fairmount Waterworks and provided a clean water supply to Philadelphia's citizens.
The importance of clean water is a general concept, and it really did come out of that yellow fever epidemic. I think the idea of that outbreak. We know that safe, clean water originated in Philadelphia based on that. Having access to clean water is really essential to health.
When the next great health crisis, cholera, struck American cities throughout the 1800s, Philadelphia's death tolls were far below other cities like New York that did not have these water systems. Throughout the 19th century, the board's public health initiatives evolved in response to new advances in medical practice. In 1865, the board took control for recording births and deaths, allowing for the identification of critical health patterns in the city's population. Responding to advances in germ theory, the board opened the Municipal Hospital for Contagious Disease in 1866. Staffed by board physicians and nurses, this hospital isolated victims of infectious diseases, preventing their spread among the city's population. Influenced by the Progressive Era, the Board of Public Health was renamed the Department of Health and Charities in 1903 and given enhanced powers to create and enforce health regulations, such as housing conditions and food inspection. The department distributed available vaccines and led public campaigns against the spread of tuberculosis and influenza. Trends in life expectancy during this era clearly demonstrate the triumph of these initiatives. Deaths from infectious and contagious diseases in Philadelphia decreased substantially from the 19th to the 20th century. From polio to Legionnaire's disease to the AIDS epidemic and even the recent outbreak of mumps at Temple University, the Department of Health still plays a large role in disease prevention and education. In the 21st century, however, the mission of the Philadelphia Department of Public Health has expanded to other public health challenges, such as food access, childhood obesity, and opioids. Despite this expanded role, in many ways, the structure and inherent goal of the modern department is the same as the first board in 1794.
We learned a lot from the yellow fever days. It really helps. It tells us how important it is to be able to measure or count the number of cases and to describe those cases in a way that we can either issue treatment or preventive actions.
Created from the depths of an unspeakable tragedy, the innovation of public health embodied by the Philadelphia Department of Public Health is a proven triumph for the people of an ever-growing and changing city.